make sure that every patient
gets safe and accurate treatment,
and that we all work
to the highest standards of our profession.
Then we will keep American pharmacy strong.
And that's our job, without question. When we talk again about the evolution of healthcare and the roles of pharmacy technicians, their roles have evolved greatly.
When I became a pharmacy technician in 1977, everybody was just a clerk. I don't even recall being called a technician. I was the pharmacist's sidekick.
As the profession has changed, the distributive function of pharmacy has been reallocated to technicians.
Now you can't, I don't think, even consider being a pharmacy technician without getting certified. Otherwise, you'll never move up out of a kind of a general clerk position.
they're involved with all aspects of the whole workflow process. They're involved with charting, they're involved with getting patients in and out of the pharmacy effectively. They're involved with checking orders to make sure that things are happening properly.
Working in a hospital pharmacy, I was responsible for sterile compounding, as well as filling Pyxis machines and doing cart fills and medication delivery to the various nursing floors and units.
A lot of the cancer treatments are very expensive, so that's, a huge part of my job is finding, the grant or the foundation or somebody to pay the copays for the patient, because otherwise they will not receive the treatment.
As you continue to have pharmacists move forward and do more with patient care, hands-on patient care, direct patient care, there's a recognition of that work that's been traditionally done by a pharmacist can now be done by a technician.
I take a prescription, I can transcribe it, I can fill it, pretty much I do everything.
So a lot has changed since 1984, when we used electric typewriters to process prescriptions.
15 years ago, there were 73,000 certified pharmacy technicians in America. Today, there are more than 280,000. The landscape has changed, and it's only going to accelerate. Fortunately, PTCB is ready to move that fast.
When you speak to a pharmacist, they'll tell you that the backbone of their operation is a pharmacy technician. And it's even more important that the technician have the right credentials, education, and training, to include certification.
I do talk to thousands of pharmacists in the country every year. And there's a complete openness and embracing of pharmacy techs, whether it's in hospital, community pharmacy, or any practice in between.
As soon as I was certified, PTCB certified, I realized that it just opened the door for greater opportunities, more trust from the pharmacists and other technicians on the team.
Certainly everyone who gets into the pharmacy technician profession needs to be certified in order to advance.
I became certified because it was important to the company that I was working for. They wanted their technicians to be certified to bring them to that higher level of education.
Being PTCB certified has meant that I'm respected in my field. I believe that I wouldn't have gotten my previous job if I wasn't PTCB certified.
PTCB has accomplished so much by leading a collaborative effort involving all the important voices in pharmacy, and there is much more we are about to do.
Recognizing the growth of the number of technicians that we will see enter the marketplace over the course of the next 10 years. We've introduced new technology, a new database management to prepare us for the future. So you look at the rigor of our program, the strength of our program, the acceptance of our program, we are the national standard.
The trend is towards nationwide PTCB certification. I think that it's better for the pharmacy, it's better for the technician, it's better for the profession for all technicians to be certified by the PTCB.
At some point, all 50 states should have a minimum standard that regardless of where that technician goes into a pharmacy, you will know as a patient what level of knowledge I have.
You would think people handling your medication, had to be educated on what they were doing. So it was a huge surprise to know that you didn't have to be certified to be working in there.
I think the pharmacists took me more seriously because I was PTCB certified. Just having this certification, I think, helped me stand out from other technicians. It just showed that I was more serious about the profession and that it wasn't just a job.
I don't think we're that far off where we will see certification be a requirement for pharmacy technicians. If you were to ask the founders at that time when they were sitting around the room, I'm not sure they would imagine the growth of the organization. And so when we look back, we are excited and thrilled about PTCB and those 20 years. So we're looking forward to another 20 years.
Who are the certified pharmacy technicians?
They are the ones who double check.
And keep the pharmacy running smoothly.
Certified pharmacy technicians are the ones with the knowledge
And focus on patient safety.
So there's no doubt that things are done right.
Who are the certified pharmacy technicians?
I am.
I am.
I am.
I am.
I am.